So I wanted to talk about breast lift and implants. This is a frequently requested procedure, often because of weight loss, aging, history of prior breastfeeding. There can be descent of the breasts, and we want to help reposition things and tighten the skin and reposition the nipple back to where it was in an earlier phase of life. However, sometimes when we do this, patients are looking for some more fullness or volume or cleavage, and doing a breast lift alone will not accomplish that. Another thing a breast lift can do is it can make the size of the areola a bit smaller if it has been stretched, or if it's a little bit a larger diameter than otherwise would be preferred. But frequently we're doing a breast lift together with a breast implant. So a small breast implant can be placed under the breast, and the lift can occur on top of this, and this will accomplish both of these goals of lifting the descended breast tissue, making the areola a smaller diameter, and providing nice volume and cleavage in the upper portions of the chest. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com.
Thanks again.